Okay.
We've got Thompson, we've got Thompson and Clem, and then we'll finish.
I realize there's a difference between the federal and the state, but information has come out on how woefully inadequate the federal program is for security. You can breach it with a simple manipulation of the Google search engine, which doesn't give me a lot of confidence. And then you're saying that our program meets the federal security requirements, where there apparently aren't any. Without end-to-end testing, what's your level of confidence that our system will be secure once it's completed? Because that's going to be a very big deal publicly.
So, Mr. Chair, Representative Thompson, I'm going to ask Aaron if he can talk about some of the security pieces that are in place or not in place.
State your name.
Mr. Chair, Representative Thompson, I'm Aaron Cardula, CIO Cover Oregon. So there has been extensive security testing that is occurring over the starting in the beginning of the summer and continuing. And as new code or new parts of the system come in, we test it for security. We have very stringent, the federal government does have very stringent security guidelines and requirements. And to the extent that there's issues with the federal exchange, those issues very likely were that they weren't following, weren't able, something was not in line with those requirements.
So this is really important. The IRS has, come out, sat down with us, and looked at the security protocols we put in place. And it just a side story, not related to the IT. So we have a room that workers do appeal. So if somebody gets a determination they don't like, and you ask for an appeal. And it's just interesting. Those rooms have to have double locks. They can have no drop-down ceilings. And they come out and look at this stuff. The IRS has done a pretty thorough job on security protocols that we're required to put in place. That said, there isn't anybody in this room that could sit out here and say nobody's going to get in our place, because it's not happening any place. The nice thing about this is that we don't keep a lot of personal information on file. No medical information is on file. It's really just the same information that we now collect as a state on Medicaid, FIAP, and it is less information than is collected today by insurance carriers or OMID around public health information, for example.